we'll see about the clinical rotation plan. In my previous video, I have shown about what is the prerequisite making the master rotation plan. I clearly told you like what are the leave schedule, part-time schedule or part-time clinical posting or full-time, number of holidays like that, and we can make it like a Monday and Saturday will be 1 week. If first you theory into practice, right? Always make a theory hours. First 2 months preferably give the theory hours. Weekly how much hour you are giving, that you put it, that will be tally. So that with this weekly, if this one timetable you can make for these 2 months. Actually before it was not a semester system, it was like a 52 weeks we made it. Now it's like a semester system, every 6 month once. It's not compulsory that you have to make a 52 weeks, but you can make it like a 26 weeks also, then 26 weeks. But here I have seen as a master rotation plan for the 1 year plan. This is for the first semester, this is for the second semester. This half of the 26 weeks will go for the first, and then next will be go for this one. You may think that why madam is explaining like about MRP. If you want to make MRP, you need like you want to make a clinical rotation plan, you need MRP. That's why I'm just giving orient you a little about the MRP. So if you see clinical rotation, master rotation plan making for this one, clinical rotation plan only you can make for only the clinical area, where you can see like you can see here is the month of March will be April and May. And then if you see again clinical complete CCB, it's a complete clinical block. If you see again will be the month of November and December. If you see this clinical rotation plan, no need to cut the theory months. It is very easy. Take only April month and March month. And in this rotation MRP, it is shown that how many hours? 228 hours. Also it is written which hospital we are going. So you always in the first semester and second semester must include, though your government hospital, you have to include your parent hospital. That will be better, because anytime INC inspection coming, they will be asking where is your parent hospital rotation plan. Are you not giving the parental hospital posting you are showing to INC? So that is the thing. Either you can give to the first half or the second half, you can very well give it. But before go to the first year fundamental exam, they have to cover these postings. So now you can see that here will be the number of students will be there. Here will be the semester. First semester this many hours has been covered. Here will be the month and the weeks. First weeks, this is the days, how many days they are going. Some will be going only 5 days. 6th day will be this one, but hours cannot complete it. So how many hours you are showing? Is it a complete block or the partial clinical block? And then weekly how many hours has been covered and place, means which hospital. This is 1 to 6, 1 to this one is called the student roll number. 60 students are there. So they equally they have to this guideline. So you can write it as a small form, and then elaborately you can write it what is male medical, all these things you can write it. Here is a community posting, because it's also clinical. This community you cannot show by where you are going. So you can make another rotation plan for these 2 weeks community plan. So in this 2 weeks, first 2 days survey like that, home visit like that, in separately this one community you have to make. You cannot show in the hospital rotation plan, but you can show as a clinical rotation plan. The overall clinical it is showing, so you are just putting as a community. So community rotation plan you can show it separately for this 2 weeks. Then will be, you can see this is our parent hospital. So the parent hospital also simultaneously posted for the students are the different month. So here is the total hours which is covering 432 hours. So weekly how much hours has been covered, it may be a full complete block or how it is covering. So and here will be the model practical exam. Every time when you have to have 1 or 2 days, you have to keep in mind that you have to conduct the model practical exam. So understand. So to make, what is the prerequisite for making clinical rotation plan? First is the master rotation plan. So the master rotation plan, in which month it is a clinical month has been shown, that month alone you have to make the clinical rotation plan. It can be either made for the 6-month system or you can made it for the 1 year. Though it is a semester system, we divided into 2. If you want to show another plan also, there is no harm in it. But in a separate plan. But here I have shown in a MRP in a one particular year for including 2 semesters, first semester as well as second semester. First half is the first semester, so the second, this one off will be the second half will be the second semester. Same way it is like written here. This is the first semester, this many hour has been covered, second semester this many hour has been covered. Then here you can write this area, and separate community rotation plan can be made by yourself, including visits and other thing can be included. Each of the clinical session completing, you have to conduct one practical evaluation. That's an internal practical exam you can conduct. You remember this one, what you are making, like a months and weeks and days and other things. MRP you have to clear about how many hours, this hours has to be cover this one, and this hour we are writing separately. You cannot write it over here, so we are making in a clear way in a clinical rotation plan. Thank you.